I absolutely feel like I have a greater capacity to serve because I have lived experience, and I feel like clients acclimate towards me much easier because they see in me what they feel inside. And so they can see me and say, okay, there's a light at the end of the tunnel because I have walked and lived that same experience. I grew up in Watsonville, California. I was raised by a single father in extreme poverty. We all raised ourselves in the neighborhood. Started off just getting into childhood trouble, ringing doorbells and running, and then turned into graffiti and breaking into cars, and eventually drinking alcohol, using drugs, and gang activity. I started drinking when I was 9. I had tried to commit suicide by the time I was 12. By the time I was 19, I had 2 children by a man who was 9 years older than I was, and he was an abusive alcoholic. I found speed and caught an addiction for that. Eventually crystal meth, and then it spiraled out of control to where I was, with the criminal record and strung out on drugs and homeless and had lost my kids and was living in South Sacramento here and there and everywhere in the gutters and the trailer parks, couch surfing, whatever I could find in and out of jail. During that whole lifespan, I was falling through the cracks. I had been psychiatric evaluations and no follow through, or I was on drugs and the psychiatric medication wasn't working. Social workers would write me off, or, I had lost my parental rights and due to an incarceration and not being able to fulfill my reunification plan. A lot of county workers, probation officers, mental health workers, ER doctors, all had touched my life and none of them had intervened. And so I fell through the cracks in every category. In 2009, I ended up taking some classes from foster kinship care education here at Woodland Community College to talk about and learn about attachment disorders. I was in the process of rebuilding relationships with my children and had been told that one of my children suffered from attachment disorder. And so I was trying to learn everything I could about it. And in the process of taking these classes at the college, I learned about ACEs and the impact that they have on mental health and substance use disorder and even overall physical health. And I started learning about the trauma that I had caused in my own children. And then I was able to put 2 and 2 together to figure out how my own childhood trauma had affected my outcomes. Now I have greater compassion towards my younger self and a lot of forgiveness towards my young adult life because I have a greater understanding of how ACEs impacted me. I eventually was asked to facilitate a class for prospective foster parents where I would teach a class on addiction and birth parents to sort of bridge the gap between foster parents and birth parents so that they could work together for the reunification. And that's when I began to find my purpose, that people started asking me to share my story and to help teach other professionals and human services workers and foster parents about the struggle that birth parents go through when they're having an active child welfare case and struggling with addiction issues. And so I began to find purpose in that, and I ended up going back to school and took some classes and was eventually qualified to become a substance use counselor at CommuniCare health centers, where I'm currently serving on the MAT team as a substance use counselor for people overcoming opioid and alcohol use addiction. And I feel like my life has come full circle because now I am that professional that touches the lives of people struggling with substance use disorders and mental health issues, and am able to give them supportive services and be the difference between their struggle and their success.